We have to find real solutions, and this is Bending the Trend. Hello, welcome back to Bending the Trend with your host, Norm Volsky. And today we are thrilled to be joined by the benefits leader over at Organon, Lori Guliano. Lori, welcome to the pod.
Thanks for the invite, Norm.
Yeah, thank you for joining us. So, Lori, really excited to have you on the pod. On Bending the Trend, we really want to create transparency and have, benefits leaders come on, talk about some of the amazing vendor experiences they've had in their careers. So, walk us through what you've implemented at Organon that did really great work that you would recommend to others.
Yeah, so super excited about this topic. Have
hmm
lots to share, but there's one vendor in particular that I'm really excited to highlight today. So,
Awesome.
we are a member of the Health Transformation Alliance, which has
hmm
been a fantastic experience of us being a member organization over there. And through the HTA, we learned about a vendor called Appley. So,
Love
Appley
it. And I'm a
is,
big Lee Lewis fan, and we've had him on our
yeah.
podcast before. So anything HTA approved is usually a very great thing.
Absolutely. Absolutely. So yeah, Lee was really instrumental in helping us get Appley up and running. So essentially, Appley takes advanced primary care and adds
hmm
kind of a digital layer to it that makes the direct primary care run through claims. So instead of
Awesome.
having to kind of contract separately and pay claims separately for that direct primary care, it's running all through our medical carrier, which means I get all of the claims data and I don't have to
Fantastic.
kind of manage a whole separate contract and program, which is really great. But the team over there is fantastic. It's led by Dr. Jerry Beinhauer, who is fantastic. And we've overall just had a really great experience. Our employees have really taken to the benefit. We've had some really great engagement. We're only about 9 months in, but we've got about 10% of our population engaged, which is no small feat, as other benefits leaders know.
It improves and increases access to advanced primary care for your
That's right. So yeah,
population.
I can talk a little bit about kind of advanced primary care generally and why
Yeah,
that was
please. I
important for
have my
us.
own comments, but I want to hear yours first.
Yeah. Yeah. So, listen, when I look at it, and I'm going to talk about medical specifically, right? Let's put pharmacy kind of on the shelf for a minute because that's its own beast. But when I think
Yes, it
about
is.
medical and and medical trend and what drives trend, right? It's really hospital costs. So when I think
Yep.
about what I want to do from a medical plan perspective to lower my costs, it's two things. One is a bit more short term and maybe one is longer term. But I want to keep people away from the hospital and I want to keep people out of the hospital. So
Yep.
what does that mean, right? In the short term, I want to be steering people away from the hospital because that's a high cost site of care. So, where
Yep.
there are opportunities for people to get infusions at home or at an infusion center, or go to an ambulatory surgical center for a colonoscopy instead of the hospital, or an imaging center for a
Yep.
mammogram instead of a hospital, right? I want to be able
hmm
to steer people to those lower site costs of care.
Now
And
you're
then when you
speaking
think,
my language. I love it.
yeah. And then when you think about, kind of the longer term, keeping people out of the hospital, I want to catch chronic diseases before they become chronic diseases, right? I want to
Yeah.
catch symptoms of things like stage 1 cancer before I'm catching it at stage 4, right? That's good for the plan, but that's good for our people, right? That's what we
Yeah.
want. So when I think about solutions and how we make sure we're able to tackle those things, advanced primary care
Yep.
fits right in, right? So essentially, I'm providing access to primary care doctors that typically don't take insurance. They're not in network. And they're doctors that have chosen not to take insurance because they're tired of the fee for service model, right? They
Yep.
don't want to have to see 30 patients a day in order to just get paid, a reasonable and fair price for what they're doing. These are doctors who
Yep.
care about the patients they're taking care of. They don't look at them as a number or just a means to getting
Yep.
paid. They want to
And
have
they
full
want to spend
accountability
more
for their
than
health.
3 minutes with their patients.
That's exactly it. So it's really bringing relationships back to healthcare. And I think somewhere
hmm
along the way, we've lost the plot on that. And healthcare has become really transactional.
Yeah.
Relationships are really important. So we feel really fortunate to be able to give that to our members.
I love that. And I would just go even a layer deeper. So, one very, very common misconception of employees is that if it's cheaper, it's worse. And I really want to dismiss, that narrative because when you look at the healthcare system, the employer is the only entity in the healthcare system that does better when their employees are healthy, happy, and working.
Exactly right.
Unfortunately, hospitals, health plans, big pharma, PBMs, they tend to make more money when, unfortunately, people are sick. That's how
That's
they
right.
make money. So I think it's really important to remember that like your employer wants you to be healthy and happy. They are paying extra to get some clinical services offered to you that are less costly for you, the employee, but still incredible high quality, higher quality than your average clinical service going through a health plan. Because if you're not getting quality today, that will be a worse clinical outcome later. And that eventually is more cost to not only you, but also your employer. So you and your employer are completely aligned in wanting you to be
Exactly right.
healthy, prevent later stage diagnosis, prevent chronic disease. So I think that's just like a very important thing. And by offering an advanced primary care option that is non-hospital affiliated, that allows that physician to have no perverse incentive of where to refer you next. So
Exactly
I
right.
think it's really important to know that unless you control the referral, you can't control cost. And having a really strategic advanced primary care strategy allows employers to have like that primary care physician as the quarterback who can then guide you to highest quality but also most cost effective care. Because if you don't do this at a really, really strategic level, overpaying for healthcare causes higher deductibles, higher premiums, more money out of your pocket and your paychecks. And that's money your employer can't use to give you raises, give you promotions, give you more take home pay. So, like, these things do not happen in a vacuum. They all are interrelated. And, your
Exactly
employer
right.
knows this. A lot of the vendors know this. It's something that motivated me to start this podcast to begin with because I think employees get the wrong idea that when a new service is offered, they just assume, oh, this must be cheaper. My employer must be saving money. That's not the right way to look at it. And it's
That's
just
right.
incorrect. They're actually trying to provide you the best quality today so that you're cheaper to insure later, meaning you're healthier. And that's a really, really
Exactly
good
it.
thing. Any
That's
other
exactly.
vendors that you would recommend in addition to Apply?
Yeah, I would say from a healthcare perspective, Appley is really kind of the standout.
Love it. Very, very nice. So, talk to us just on like what has happened in these last 9 months that allowed Appley to, really deserve your praise. What have they done where you're like, hey, we've seen it in clinical outcomes, we've seen it in cost data that they're just doing a tremendous job. Anything statistically or anecdotally that you can share?
Yeah, we're still a little early on the
Hmm.
data that's coming in. We've started to see some early indications, a little bit of a dip in some ER utilization. Hard to say if it's correlated, but we've seen that. I would say just generally though, the simplicity of what they're able to do of
Hmm.
instead of having to try to figure out how I get my claims data. And the idea of direct primary care is that these doctors are practicing at the top of their license, right? So they should be treating a lot more for my members than a typical fee for service primary care doctor. So I want to
Yeah.
know what my members are going to their primary care doctor for. So the way that it
Hmm.
works is the primary care doctor, just like they would typically bill for whatever services they're providing, that's still coming through as a claim. It's just a $0 claim. So Appley
Yeah.
is able to take that from these doctors who typically don't submit to insurance, translate it
Hmm.
into a claim, and then submit it to my medical carrier. And then it's paid. So there is no member cost share of this. This is completely paid for by the company,
Yeah.
but the member still gets the EOB that says you went, it was $0, and then I have all of the data in my data warehouse. So there's this great idea of advanced primary care, but how you operationalize it, right? And
Hmm.
I think Appley has really found a way to make this easy and usable for plan sponsors using
Yep.
infrastructure and codes that already exist in your plan today. It was was really more of a communication to the carrier about how it's going to work and making sure that they
Yep.
understood it rather than needing to get buy-in, right, to add an
Mm,
additional network or a customized network where you run into a lot of challenges with that
I
just from a
love that.
perspective.
Really fantastic. And, you have employees that now get to spend like a significant amount of time with their doctor. It's not just like a couple
Right.
minute visit. They get real quality time, real quality conversation. They're able to ask questions and it doesn't cost them a penny. Like unbelievable, such an amazing benefit.
Exactly
Is
it.
there anything that doesn't exist today that you wish did? We have a lot of entrepreneurs that watch this and we want to motivate people to, create things that don't exist today.
Yeah. So when I think about kind of a long-term strategy of what I'd love to see in the next 5 years, right?
Mhm.
I think the idea of advanced primary care is kind of the foundation of that, right? So I've now
Yep.
got these quality doctors who are referring out to other quality doctors or to the best hospital in the area, not necessarily the most expensive hospital in the area. But what I'm doing with
Hmm.
Appley, how do I do that on a broader scale? So even
Yep.
when I think about, essentially the direct primary care is a cash-based model, right? You
Yep.
typically pay a subscription, you pay the fee, and then you get the service and it's cash-based. It doesn't typically run through insurance. How do I
Yep.
scale that? I would love to see a vendor that offered the same kind of arrangement with imaging centers, the same kind of arrangement
Hmm.
with ambulatory surgical centers that has a national network of direct contracts with hospitals that employers could just opt
Yep.
into. They've done the work. I can opt in. I get the benefit of the cash price and helping us operationalize how we pay for that because we're kind of a smaller large employer.
Yeah.
So it's difficult for us when we've got a national footprint. I can't go out and negotiate direct contracts with hospitals in
Hmm.
all of the areas where, my employees are. But if there's a vendor who's doing that, I know Mark Cuban is starting to kind of do that through Cost Plus
Yep.
Wellness, but I would love to
He'll be
see a
joining
vendor
us
who's
on the
just
pod
pulling
very,
all of
very
that
soon.
together.
So,
Yeah,
yeah,
that we
I
could
love
just
it.
kind of sign the contract, opt in, get the benefit of those cash prices at those quality providers, and be able to provide really good quality
Yeah.
care, not just at the primary care level, but beyond
Yep.
that, and have a really good vetted network to refer people into when they need care beyond primary care.
Yeah, like essentially benefits leaders not only have to run their own custom health plan, but they almost have to create their own custom health system because of like the cost pressures that exist and the
Right.
fact
I mean,
that
if you're paying
the
attention,
hospital
right?
monopolies cause people to have these like creative alternatives
Mhm.
because, they do price gouge, in certain areas where they know like they're getting the majority of patients regardless of cost. And, now there's always innovation needed to be able to drive value in a market that's inefficient. So a lot of excitement to come, but I think a lot of that comes down to just like ease on the patient, ease on the employee. If
Right.
you have all these fragmented systems, like they're great in a vacuum, really hard for an
Yes.
employee to be able to, organize and like keep in mind at all times. So it's like having all these different things that are great, but having a cohesive experience. So it's as easy as just calling a local health system who has everything. You want that same experience at your own quote unquote digital hospital or custom, alternative hospital that you've created, within your health plan that's
That's,
self-insured on the employer
that's
side. So
exactly
really
it.
exciting things to come. I think we'll definitely, be monitoring all of these trends. And again, thank you for joining us on
Yeah.
Bending the Trend, Lori. Thank you for doing everything you can to fight rising healthcare costs along with us over at Bending the Trend and keep doing the great work. Really appreciate it.
Yeah. Thanks so much, Norm. I appreciate the opportunity.
All right. Thanks for watching Bending the Trend, where we are looking to fight rising healthcare costs. We are asking benefits leaders what digital health solutions they've implemented that has helped them bend the trend.